And the conversation quickly shifted to, well, can he do his duties as a U.S. Senator? And that became a conversation about determining competency when you're having mental health difficulties. And then that evolves, and all of them.
Right.
One sentence leads to another. The next sentence becomes, well, what about on an overall decision-making standpoint for people in their personal lives? Depression is something that we still don't have a great grip on, do we?
Well, I mean, we know more about it than we did when I started in psychology 40 years ago. We know the brain changes. We know the chemical changes in the brain that accompany depression. We know the mental and emotional changes that accompany depression pretty well. And we know that depression is a wide range of symptoms. I mean, there are people that have depression that's mild to moderate, that they really don't need medication, some counseling, and sometimes they can just weather through it with support from their family. And then there's the more severe forms of depression, of course, which can become temporarily debilitating. Mm-hmm. Most of the individuals who suffer from depression, however, are not incapacitated. We use the term incompetence. It's a legal term for legal capacity.
Sure.
But capacity is the ability to do something. Capacity could be the ability to pay bills, take care of yourself, drive a car, make medical decisions. Mm-hmm. Capacity is a very strong ability that human beings have, that it takes a lot to knock it down, to completely knock somebody out. I want to congratulate Senator Fetterman for being straightforward with his depression. He apparently has had a history of depressive episodes. Many people do. 20%, by the way, of the American public will experience depression in their lifetime. And he came out with it, and I'm glad he did. And he recognizes that he needed treatment. Also, that stroke he had back in June. After you have a stroke, a number of people post-stroke have depression. Mm-hmm. That can come on weeks or months after the stroke. And so that probably contributed as well. The question about the ability to make decisions, almost all your decisions are completely intact. It becomes a question of you're not concentrating very well, you don't feel very well, you're not on the top of your game. Mm-hmm. So he wants to get back on the top of his game. Is he incapacitated from making decisions? I think it highly unlikely. The fact that he sought treatment tells me he's making good decisions.
Yeah. And the term clinical depression became a hot topic last week as well, with the idea that it's much more difficult to contend with than other forms of depression. Was that really the case, or were they making too much?
No, I think clinical depression is a term people toss around. Really, depression, major depression recurrent, which is the diagnosis in the DSM, is mild, moderate, severe, and very severe. So all depression is clinical depression. The question is the degree of severity. Mm-hmm. And so in this particular case, I mean, I've treated people all my life with mild to moderate to severe depression. Even individuals with severe depression only really are incapacitated for very short periods of time during the depth of the illness, when they're really immobilized. But they recover pretty quickly. So it's not a question of the person having capacity that's gone and can't have it back again. Short periods of time. When the president, interestingly, most people don't know this, when the president undergoes surgery and has like anesthesia, they are temporarily incapacitated. And so the vice president must assume responsibility for the operations of the country during that period of time, and as they're recovering from anesthesia, which takes about 12 to 24 hours. So temporarily, we all can experience periods of time where we're not on our best. What John Fetterman has done is he's made a decision that the depression was impairing his ability to be at the top of his game. That's what I think. And so he decided to get treatment so he'd get restored to function very, very well as a senator.
When someone suffers traumatic brain injury, as he did with his stroke, the frustration, you can sometimes, when he talks, you can hear the frustration in his voice that he knows what he wants to say.
Right.
He is perfectly cognitive of what it is that he's talking about, but his brain won't form the words for him.
Well, he has a receptive and expressive, mild expressive receptive aphasia from his stroke, and he's using adaptive devices, which will work quite well for him. But your cognitive ability, your mental ability, your decision-making ability, your understanding of your condition is completely intact. So it can be incredibly frustrating. If anyone's ever had a stroke or had aphasia, it's incredibly frustrating because you know what you want to say, but you just can't say it. Or you hear people talking to you, but it doesn't make any sense, but you know it should. And so in the severe forms of aphasia, that's what you face. But he's recovered well, as I understand, and he's using compensatory devices, which will help him be able to do that. But his reasoning, from everything that I've heard or understood, is completely intact.
Let's talk about people in general. Senator Fetterman is one case, and everybody is their own specific case. But
Right.
people in general, when they're dealing with depression from having had traumatic brain injury, there are certain things that people around them are aware of or become aware of
Right.
as the recovery process goes on that might surprise them.
Right.
But we're a pretty adaptive group, aren't we? That we should be able to step in and help where we can, and really decide where the boundaries are.
Most individuals are capable of providing feedback regarding what they need in their recovery, unless they're very severely impaired. And if they're that severely impaired, then they were going to need extreme supports. But short of that, engage the individual in what they need in their recovery. Allow them to do what they need to do to improve with support, with understanding, and with encouragement. There are two extremes, of course, in any situation like this. One is to completely ignore their needs and say, they'll be fine, they'll be fine, they'll be fine. The other is to over-support them or intrude upon them or try to take too much control from them, which makes depression worse, by the way. It's humiliating and difficult enough when you're facing these challenges and trying to recover than have somebody kind of pile on and make you feel worse. Even if the intention is good, I want to help, you want to engage the person to find out what they need to do for themselves so that you can assist them.
A big part of every conversation surrounding depression then is what happens if it is not treated. If someone decides they're going to tough it out, I'm just going to fight through this and get to the other side somehow. Sometimes that's a very tragic decision.
It can be because, of course, one of the worst consequences of depression is when it digs into your brain and you become hopeless and you feel like life's not worth living anymore, and suicide can become an outcome of that. We know that 90%, we've talked about this many times here, 90% of the suicides in the world are related to some type of mental health disorder, usually untreated. And so I always say to people who are suffering from depression, particularly when it moves into the moderate range, seek appropriate counseling and or psychiatric and medical help for the depression. Depression can sometimes resolve on its own over the course of months, but it can be a very rough few months, unnecessary pain and suffering. When you can have help, they can get you through it.
Yeah. And people can see the people around them who are suffering from depression. They can watch as their condition deteriorates, and they deny themselves the opportunity to get that treatment, and sometimes they become their own worst enemy in that case. And somehow the people around them have to find a way to break through.
They have to find a way. And, sometimes it's simply a matter of having an intervention with the person, setting them down, saying, look, this is what we're seeing. We know it's difficult for you. It's embarrassing. I think one of the most important things when you're doing interventions with someone is to recognize deep down inside they know something's wrong. They just are embarrassed and ashamed and humiliated. So what you want to do is appreciate that point. Put yourself in their shoes. Appreciate that point, but through love and encouragement, go with them to appointments, to an appointment with their doctor. And I would recommend going to a physician to make sure you get a good medical examination first, because sometimes depression can be the result of biochemical changes from illnesses or medications you might be taking or other metabolic problems. So the first step if you're suffering from depression is get a good physical, get a good examination to rule out the medical things that may be treated simply. And then if it progresses or it's more than that, Therapy is extremely effective for depression. And this is something that, of course, as being a psychologist and have done this for 40 years, I've seen many, many people recover with therapy. And then medication often for depression needs to be put onto that mix to facilitate recovery. But most people with major depression recover well. Many need treatment.
In Harrisburg right now, there is legislation proposed by Representative Struzzi, and he actually serves on a committee that is helping to fashion or craft some legislative responses to some of the roadblocks that stand in the way of mental health treatment. Hospital treatment is, a very difficult quandary for a lot of administrators because people end up in the emergency room, and that's not where they should be, but people have no idea where else to take them. So those issues are still being worked out in Pennsylvania, but overall, there are resources out there.
Absolutely. And the emergency room, of course, is the resource of last resort. And I commend Jim Struzzi for his work. This is long overdue. The bottleneck in emergency rooms for mental health consumers has been long standing. There's not enough inpatient beds if the suppression is severe, like John Fetterman sought admission. There's only 30% of the necessary inpatient psych beds in the United States right now. Mm-hmm. So the bottleneck occurs in the emergency room. My recommendation is don't wait until it gets that bad. Don't wait until you need the emergency room. Recognize the symptoms earlier. Go to your doctor. Go to a therapist. Get evaluated and get treatment before it progresses. That way you don't need to go to the emergency room. You haven't waited that long. Of course, if it's so bad that you're at risk to yourself, you're experiencing suicidal thinking, you're a danger, go to the emergency room. You will be helped. There will be assistance available. There's also a grant that's come available that Indiana County, Open Door, and such are going to work with the hospital to establish a crisis diversion program there, which I think will be a tremendous asset to the community once it gets up and running.
Yeah, it's going to be interesting to watch how that develops.
Yeah, very much.
Yeah. He's Dr. Ralph May joining us this morning with some hopeful words. Appreciate your visit.
Thank you, Todd.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 11.